It is our pleasure to have the opportunity to introduce our distinguished guest speaker, Dr. Amjad Hammad. Dr. Hammad is a Vitreo-retinal specialist practicing in New York. He's the founder and the president of EyesNY, a group practice. He's also the co-founder and owner of the New York Eye Surgical Center. He's a past president of the New York State Ophthalmological Society and counselor at the American Academy of Ophthalmology. Dr. Hammad is American and Jordanian board certified in ophthalmology and has finished fellowships in neuro-ophthalmology and vitreoretinal surgery. He has also obtained an MBA with distinction from Yale University. Dr. Hammad is clinical assistant professor of ophthalmology at Albany Medical Center and adjunct professor of business at Clarkson University. Today, Dr. Hammad will speak about reserve brain drain, the impact on health reform JA experience. Welcome, Dr. Amjad Hammad.
Thank you. Thank you so much for the kind introduction. And I want to take the opportunity to thank the organizers of this wonderful conference and for being asked to present here. I know you've already heard from quite a few good presenters already about different aspects of leadership and changing healthcare. I'm going to take this and approach this from my own perspective and from the perspective of my colleagues here in the US who are all originally grew up and trained in medicine in Jordan and have come over to the United States to do the training and are thinking of ways in which we can help our home country. Obviously, Jordan and Palestine, as we all know, are very closely connected in our hearts and our minds. And I believe that there's a lot of lessons that could be learned, that could be applied in Jordan and hopefully in the future in Palestine, in a free Palestine. So the topic and the subtitle, of course, is reversing the brain drain. Now, when we talk about brain drain بالعربي اللي هي هجرة العقول, it's a noun, and it usually implies the immigration of a highly trained or intelligent subset of people from a particular country to another country. And infamously, the US is very good at draining brains from all across the world. And it's a problem in almost every country out there, but particularly in our countries in the Middle East. We do know that there are over 2,400 Jordanian American physicians as a conservative estimate working in the United States. The US, through the match system, accepts about 200 to 400 graduating medical students into residency programs, usually internal medicine and family medicine and pediatrics, but there are definitely people, Jordanians and Palestinians in surgical specialties all over the United States. Many of these doctors, those thousands of physicians, are experts in their field, and they lead distinguished academic departments. They're leaders and managing partners and private centers of excellence and different private groups. The story of JA, or Jordanian American Health, which I'm going to talk about, starts with another JAP, JAP, Jordanian American Physician Group, which many of you are aware of. And if many of you are on Facebook, you know this Facebook group has existed for over 8 years. It was an informal site where we could get together, we could discuss topics of interest, and catch up on the happenings in Jordan and the happenings in the US that affect us all. This story changed around the head of COVID. When COVID-19 hit Jordan, there were about 50 Jordanian medical students who were in the United States that were stranded, and they couldn't find a way to get back. So we did a charity, we did a fundraising, sent those medical students back to Jordan. We put them in hotels and then put them back to Jordan when the airports opened up again. And then there was another charity drive for high flow oxygen cannulas. There was webinars to train Jordanian physicians on the latest management of COVID in the United States. And then lately we've started an ICU fellowship in Jordan. And there's always been the drive of what more can we do? How can we apply our expertise and our knowledge to aid Jordan and reverse that expertise that's been leaving Jordan for the past few decades and try to bring it back to help the Jordanian healthcare system. So we did a study, we did a feasibility study, and we hired some consultants to look at the Jordanian healthcare system. And we found several issues, and none of these are news. We are well aware of these. There are actually issues that exist in almost every healthcare system in the Middle East, in particular Jordan and Palestine. It's a fragmented healthcare system. All hospitals and clinics in the private are competing, and they work in silos. And it's a tiered system. There's very excellent care in Jordan for people with money, but that's usually just the western part of Amman, not even all of Amman, and the rest of the country does not really, cannot afford to avail themselves of this excellent care. And there's really no way of identifying the quality care. You cannot tell who's a good physician, who's not, who's a wonderful hospital or not in any particular day. So there's some cynicism in the public. They feel that there's some misguidance in advertising, and there's a reputation loss to healthcare professionals from a few bad apples in the system. And the most primary issue that we saw and that thought that had to be addressed was there's no good primary care infrastructure. Without primary care physicians or family physicians taking care of the usual medical problems, and without guiding individuals into specialists that can take care of their particular problem and not just haphazard care, there was a lot of redundancy of testing and procedures. We did comprehensive healthcare research and the market research for Jordan. And even though the Ministry of Health is the one that is considered to be providing the primary care, and even though there was a good number of primary care centers to the population, we found that there was a poor distribution of healthcare clinics, and there was a lack of enough healthcare primary care in the most populated governorates, which is Amman, Zarqa, and Irbid. And even when there was a comprehensive healthcare center run by the Ministry of Health, there was lack of facilities, lack of good labs, lack of good imaging centers, and the specialists that were needed were not always available. There was dire need for gynecology, pediatrics, and ENT in particular, as well as orthopedics in those comprehensive healthcare centers. And of course, there was a lack of a team approach where a patient is taken care of holistically, and there are not just physicians, there are nurses and therapists and social workers taking care of the whole family as a unit, and not just the patient themselves. And actually, with the organization that did the best job in doing that kind of care was the UNRWA, United Nations Relief Agency, which takes care of a lot of the Palestinians, of course, in the camps in Jordan. So the challenges we saw, again, nothing new here, but we're well aware of when we drill down: shortage of skilled workforce funding, weak infrastructure, very high number of patients to the primary care doctors, the lack of coordination, and no proper supply chains. The patients complain about waiting times, not having the specialists, not having the facilities that are necessary from imaging and so on. And the EMR system was archaic and was not installed in all centers and didn't work all the time. So we considered a solution of creating a primary care-based system with a presence in all areas of need in Jordan. We thought about developing a network of these comprehensive healthcare centers in all over Amman, in particular East Amman, which is in dire need, and all of the different governorates to cover Jordan. These patients will be taken care of, 75–80% of their problems will be taken care of in those comprehensive healthcare centers. Now, patients that need extra specialized cares will be sent to hubs or centers of excellence. And there, other specialists will be such as oncologists and GI specialists and cardiologists. We will work and collaborate with the current healthcare system in Jordan. We'll work with every hospital and system there. We'll be agnostic. We will demand quality care and best practices that are being applied in the United States to all our partners. And the idea is to develop a primary care system that will emerge into a secondary care system, and eventually there will be a tertiary care, which will be either working with or with merging with a local hospital. Concentrate on high quality care, affordable, convenient to the masses. And of course, it has to be affordable. Some people cannot afford even a low charge, so we'll have a charity arm with a percentage of all profits plowed back into that. We will hopefully have some residency programs and training for all the new graduating physicians in Jordan. We are considering family medicine, internal medicine, peds, OB, as well as emergency medicine residencies that we will try to get accreditation, especially with ACGME International. And the idea is not just to concentrate on physicians, but also nurses, technicians, and therapists develop their skill sets so we can all work together in a team fashion. We have over 200 US trained Jordanian physician founders in and out of Jordan, and some will be available via telemedicine all the time to support our venture. We are registering as a for-profit healthcare company in Jordan. We have done an infrastructure assessment, including regularity changes and compliance, and we have had a lot of support from the government of Jordan and the Royal Court in implementing some changes necessary to make our vision work. We have discussed public-private partnerships with the Jordan University and Yarmouk University for the residency and academic programs. And we have had discussions with many private hospitals about synergy and cooperation, and we have been received very well. But only time will tell how those relationships will proceed. Thank you very much.